In your research and personal experience, about what percentage of vaginal breech births require manual intervention by the provider to get baby out?
Well, it's changing for me. I mean, I used to do all breeches on people with women on their back in lithotomy position. That's how I learned to do it. So only in the last 5 or 6 years has upright breech sort of come back as favor. So when a woman's on her back, you almost always have to do some manipulation because you don't have gravity and the natural flexing of the head that occurs when the baby's hanging on all fours. So when women are on their back, hands-on is, I mean, you can let the baby come out to a certain point, but then usually one shoulder you'll sweep, the other shoulder you'll sweep, and then you just do your little Marcel Smelly-Veit maneuver and you get the head out. So I would say a high percentage of people on their back and maybe 20% of people on their all fours. And baby will tell you exactly if it's necessary or not by a couple of things. One is once the baby reaches the umbilicus, we don't touch anything. Sometimes we put a little warm compress on the perineum to protect the perineum. But other than that, we don't really try to touch the baby. When the baby reaches the umbilicus, we usually like to see the head out within 3 to 5 minutes. And 3 to 5 minutes can seem like an eternity. So it's a really long time. So it's hard sometimes to sit there and watch a baby hanging halfway out. Wow. But you don't need to do anything. As long as the back begins to rotate toward the sacrum, what we call the baby rotates sacrum anterior, or the baby's tongue rotates to mom's bum, tongue to bum. And when babies rotate like that, that tells you that both arms are in front of the chest and will come out on their own. When they don't rotate, it usually implies that either one or both arms are behind the head. And that a baby's elbow or stuff is often usually getting stuck on the mother's symphysis, and it will not come out unless you go up and sweep it down and out. So I would say that in babies that have been properly selected ahead of time, which is almost all my breeches because I meet them ahead of time, that when they're on all fours positioning, helping them is probably one or two out of 5.
Gotcha.
20-30% of the time.
Wow. That's fascinating.
That's just a number I cooked up. I don't have any data to back that up.
Gotcha.